Okay, my name's David Walmsley. I'm the College Mental Health Coordinator. I'm just going to talk a bit about the support available for students within the university and things that tutors and academic staff might be usefully be aware of if they're working with students with mental health issues. I suppose the first area it might be useful to think about is students managing their workload independently, so completing assignments and accessing resources from the library. Students with mental health issues might find some elements of these tasks overwhelming. So obviously tutors can offer support in a practical sense in terms of being available and offering advice and support. I think it's useful for academic staff to know about the other resources, such as myself, within the university, so they can refer students if they feel they need more help, then they can give them. I mean, we would work with the library to try and support students to access maybe extended loans or some sort of flexibility if they were, say for example, they're on medication that was making them drowsy and limiting the amount of time that they could focus on their work for. And then another area that academic staff might like to think about, I suppose, is attending seminars and lectures. Students with maybe anxiety or depression might find these situations quite overwhelming. I suppose you're taking a lot of people, you're putting them in a room together and you're asking them questions sporadically, and that can be quite intimidating for somebody, especially if they don't have a huge sense of self-confidence at a particular time. I think academic staff can be supportive in that context by following students' requests and following students' suggestions. So some students prefer to be able to answer questions and give their own opinions under their own steam rather than being singled out in front of other people. Sometimes it might just be small things like offering encouragement if you know that student is going through a particularly a difficult period, or taking the time to talk to them and find out from them what would be helpful, what would help them carry on with their learning, what will help them come to these seminars. Sometimes it might be small adjustments that you can make. If it feels like it's becoming a more complicated situation, then that's when I recommend that tutors refer to our service, because usually it will be that a student might require more time, or there might be some negotiation that needs to take place in terms of what the college can do and what the student can do to help them manage their condition as well.